Spread out the mattress cover and the sponge mats. Mattress cover comes with 2 zippers for easy installation. Install the headboard and footboard. First, align the hole positions on the footboard and bed base. Insert the screws, then tighten them using a hex key. Install guardrails. Raise the backrest to its highest position. Insert the guardrail into the hole, install the gasket and nut, and tighten with a wrench. Lower the backrest. The mattress cover is equipped with 5 straps on each side, which are tied to the bedboard to prevent the mattress from moving during use. Back lift adjustment assists patients in getting in and out of the bed, reducing lumbar stress. Knee lift adjustment reduce leg pressure and promote blood circulation in the patient's legs. Back and knee lift adjustment promote patient blood circulation, facilitate eating and drinking, and enhance comfort. The bed can be lowered from 31.1 inch to 21.2 inches, excluding the mattress height. To rotate the bed base by 90 degrees, first press the reset button, then press the bed base 90-degree rotation button once more. To reset the bed base, first press the reset button, then press the bed base 90-degree reset button once more.